So my job is to take this section and really give you guys the ag perspective on the antimicrobial issues that we face. And so if we look at the key resistance issues at this human-animal interface, I think that's the starting point, but really the end goal is to develop specific stewardship guidelines. And that's kind of what we're asking you guys to do. I think Dr. King has already thrown down the challenge of doing that. And I think there are two things that we can talk about today and we're going to talk about today. One are what are the specific antimicrobial bacterial combinations of interest to both of these groups. And really, when we get to starting to develop stewardship guidelines, we need to understand beyond just the individual animal, we need to understand the ripple effects that go out. And so what are the risks and benefits of using antimicrobials in animal agriculture? I know it's been mentioned that we've faced roadblocks. This can be a contentious issue. One of the things, my job, I guess, is to focus this conversation. I'm going to say that this should be the common ground. So our common ground should be that antimicrobial resistance is a real phenomenon. And I'm going to suggest that we should say it's complex and incompletely understood. And I think that's okay. It's okay for us to recognize what we know and what we don't know. And if we do that, then we can take the points that we don't know and take that data and move forward. And if we recognize the points that we don't know, we make decisions on incomplete data, as has been suggested, or we wait until we have complete data to make solid scientific decisions in that arena. I think the other piece of common ground that we all have to have is that antimicrobial resistance is a bacterial response that's propagated by both the agricultural and human uses of antimicrobials. I'm also going to suggest this as common ground, although I know that this may not be as widely accepted. And maybe that's a goal for this group at this meeting, is to help define what is the acceptable risk-reward of antimicrobial use in animal agriculture. And so these are the basic goals of antimicrobial stewardship guidelines. I actually got these from the Infectious Disease Society of America, so these are not things that I came up with, but these are the widely accepted goals of stewardship programs. And the first is to maximize clinical outcome in the individual patient. And we certainly want that in animal agriculture. I think Dr. King said it best, that this discussion is not a loss until we no longer have the ability in animal agriculture to affect a positive clinical outcome in our patients. We also want to make judicious use of our antimicrobials. And so with that in mind, we have to consider resistance development, and most of the stewardship programs would say economic benefits or treatment costs, and we'll talk about that a little bit today. I think this is our goal for a stewardship program. And this is probably one of the bolder statements I'll make today, so pay attention. I think if we really, really want to take this discussion forward, there probably are a few things that we need to set aside, at least for the time being. And I'm not denying the existence of any of these. That's not the goal. But the goal is, if we have to prioritize the things that we are going to talk about, that means we have to deprioritize some things as well. I'm going to suggest that we probably shouldn't even talk about growth promotion or feed efficiency at this meeting. I think with the FDA guidance documents that are coming into place, all the industry sponsors in the animal health sector have agreed to comply with those, and we are now in the basically transition in period for those uses, or transition out period for those uses, the transition period in for that guidance document. I also think topics such as the environmental or indirect spread of resistance, and that's primarily I'm talking about in the animal health industries. They undoubtedly exist, but quantifying the risk, as has already been said, is nearly impossible. I think that data is coming. I think there is a lot of active research in that area, and this isn't a set it on the table and forget about it issue. I think this is a set it on the table, watch to see what the science says as it moves, and then make decisions based on that. Also, the international spread of resistance, again, within the human community. Dr. Tokes has already mentioned this today. It's undoubtedly causing issues probably with specific pathogens, But again, it's very difficult to quantify, and when we bring that into the general discussion of antimicrobial resistance and animal agriculture, it typically leads to a roadblock. So I'm going to talk actually probably a little bit about the human perspective, which not because I'm a human authority, but I want to talk about the methods as far as how we could identify specific bacterial antimicrobial pathogens and combinations of importance, because I want you to understand that how we would identify those combinations on the human side, because they've been talked about already today, because I'm going to use the same methodology to come up with those combinations for animal agriculture. So I'm essentially saying these are the methods that we should use if we start to identify these priorities. So this report's been mentioned a couple times already this morning, the CDC's Antibiotic Resistance Threat Report. And the methodology that was used in that report is it's a population approach. They use laboratory-based surveillance that's then extrapolated out to the entire U.S. population. If you read that report, it very clearly says it's probably an underestimate of true disease prevalence based on underreporting and actually contributing those diseases to the actual cause of death when you talk about mortalities. The surveillance data is then married up to the National Antimicrobial Resistance Monitoring data, which is the NARMS data that's been discussed already. And so we take a percentage of isolates that are resistant to a certain antimicrobial, we apply that to how many cases of that disease do we see, and then we come up with our threat assessment. That also included a few other things, so those are the actual numbers, but the classification as urgent, serious, or concerning was based on other factors, such as what is the clinical impact of that disease, what's the economic impact of that disease, and specifically resistance in those diseases. The 10-year projected incidence, which I think is something that we need to talk about. The CDC has built in flexibility in their stewardship program for reevaluation. So these classifications are not set one and done and then we focus. There's a plan to reevaluate as things move, as the science changes. So again, there were 18 threats that were listed in that report. There were 2, as Dr. Tokes already mentioned, that were specifically linked to animal agriculture, and that was Campylobacter. The drugs of importance for Campylobacter were azithromycin and ciprofloxacin, and then non-typhoidal salmonella, and the drugs listed were ceftriaxone, ciprofloxacin, and then there was also a concern about multi-drug resistance, so the resistance to 3 or more classes of antimicrobials. So the World Health Organization has also done a similar assessment, although they used a different methodology to do it, and they prioritized antimicrobials as critically important, and they focused on the antimicrobials, but they also considered the pathogens or the disease complexes of importance for those pathogens, because they looked at how many people are affected by those diseases for which that antimicrobial is one of limited numbers of therapies. They looked at the frequency of use of that antimicrobial in human medicine, and then they looked at how confident they were that resistance could be spread from non-human, i.e. animal sources. They actually prioritized the list a little bit. This isn't the full list, but these are the priorities within critically important antimicrobials for the World Health Organization. So the glycopeptides, the cephalosporins, specifically for E. coli and non-typhoidal salmonella, the fluoroquinolones, and we're looking at Campylobacter and salmonella as well, and then the macrolides classes for Campylobacter. I'm going to suggest we leave the glycopeptides off the table for this discussion. The glycopeptides are not approved in the United States. They're actually illegal to use in food animals in the United States, and they have never been approved in the United States. So I think if we take the World Health Organization's report and make it more US-centric, we come up with a list like that. If I've done a good job of summarizing those 2 reports and those 2 methods, really this is what we come down to. The bacteria of concern with an animal risk exposure would be Campylobacter and non-typhoidal salmonella, and these are the drug classes we use to treat those pathogens. So using the same methodology, I can't use it exactly because it hasn't been done that way. The OIE has done they took kind of the World Health Organization's report and used a similar methodology, but for the US kind of centric approach, we have to combine data from a couple sources. So if I start with the OIE, they put together a working group on antimicrobial resistance, and how they classified antimicrobials in veterinary or animal agriculture as critically important. They looked at two factors. They surveyed their working group members, and did the majority of respondents classify that antimicrobial as critically important, highly important, or important? And when we look at those antimicrobials, are they the sole or limited therapy for a specific disease indication? And if they met both of those criteria, they were classified as critically important. That list is actually aminoglycosides, penicillins, the phenocols, sulfonamides, and tetracyclines. It also includes the cephalosporins, and I put the reasons on here so that, because this is where we're kind of getting down to narrowing our focus. The reason cephalosporins were included on the OIE critically important list were because they were used for treatment of very serious infections in veterinary medicine, or they were one of sole or limited therapies due to spectrum or resistance. And I will actually add to that, and I will say, in food animal veterinary medicine, we are not given an open drawer of antimicrobials. We have restrictions on the drugs that we can use, and so those restrictions also contribute to the reason the cephalosporins are one of limited or sole therapies for certain indications. The macrolides were considered important because they are one of few alternatives, specifically when we talk about mycoplasma infections in swine and poultry. They're also very important for the treatment of bovine respiratory disease. And the fluoroquinolones were considered important because we reserve those for treatment of various serious infections across a wide range of species. And that would be worldwide. I'll talk about the U.S. View on fluoroquinolones. So what are the diseases of concern in the U.S.? And it's hard to identify specific pathogens because within a species we have multiple pathogens that contribute to these disease complexes. And when we look across the range of species that we treat in animal agriculture or veterinary medicine, it's really easier to just boil them down to the complex. And so this data is actually taken from the USDA's survey data. They publish summaries of death loss in the different industries. Poultry is not included. That summary is a little bit different, so I wasn't able to extract the same information out. So poultry is not included, although I'll make a comment. Respiratory disease is the primary disease complex we face across most of our animal agriculture industries. The number one cause of death in beef and swine operations, the number 2 cause of death in dairy operations, number 7 for sheep. My guess is that it would probably rank very high for poultry as well too. So if we're including that in there. Digestive diseases, somewhere in the middle, ranked number 3 through 5 for most of these industries. And the one you can't see, there's a classification of other diseases, which includes mastitis and foot rot. And those would rank from number 1 in dairy to number 5 or 6 with beef operations. And so we're facing, these are our predominant diseases. Now, the contentious point about which antimicrobials are important in human medicine and veterinary medicine is about, okay, where do those diseases sit and which antimicrobials do we use to treat those diseases? This is a list of the indications for the macrolide class. I'll start there, off of the Animal Drugs at FDA website. So these are all the drugs that are all the disease indications that are approved for macrolides. And you can see our most important ones. So respiratory disease in cattle and swine, mastitis in cattle, and then a myriad of other diseases. It actually goes down beyond the screen. We have honeybees on this list as well. There are macrolides for prevention of Penibacillus larvae. So we face a broad range of species and a broad range of diseases that we use the macrolides for. The fluoroquinolones, we have 2 label indications for the fluoroquinolones, and I think it's important for those of you that aren't familiar, it's important to note that currently in the U.S., veterinarians are not allowed to use fluoroquinolones extra-labelly. So these are the only uses of fluoroquinolones in the United States. But again, they are our most serious diseases for these industries. The cephalosporins, it's kind of the middle road here. We have certainly our most important diseases, so bovine respiratory disease, swine respiratory disease on there. But we have a broad range of species that we use the cephalosporins in. And under current law, and this has changed in December of 2012, extra-label use of this class of drug has been limited. So we, as veterinarians, are allowed to use this class for other diseases that are not on this list, because there are a myriad of diseases we use cephalosporins for, and the drug sponsors and veterinarians could not get all of those indications on a label. But we are restricted from using these drugs at a different dose, a different route, a different frequency of administration, and we're also restricted to classes for which this drug class already has label, classes of animals that this has label. So if I take that information and summarize that down, you can see where there is a great overlap between the drugs of importance in human medicine and the drugs of importance in animal agriculture. And I think it's easy to make stewardship decisions in a vacuum, where we look at this list and go, okay, there's overlap. Obviously, human health is more important. How do we move forward with that? But I think it's important to understand the risks and benefits of how we use antimicrobials in agriculture to make broader decisions that don't have unintended negative consequences. And I think that when we talk about the risks of using antimicrobials in animal agriculture, the one that is always mentioned is we contribute to bacterial resistance in human medicine. Again, Dr. Tokes presented this data. This is out of the CDC report. But I think the one piece that maybe doesn't get as much limelight is that we also contribute to antimicrobial resistance in veterinary medicine. And in my laboratory, currently, it's not many days that go by where I don't see a report their antimicrobial resistance has an impact on my veterinarians and my clients. Since 2011, more than 60% of the Mannheimia hemolytica isolates that we've recovered in my laboratory have been multi-drug resistant. So Mannheimia hemolytica is the primary bacterial pathogen of bovine respiratory disease. So it is a very serious pathogen for us. Multi-drug resistance, so I'm talking about 3 or more classes of antimicrobials. And because of the extra label restrictions, the restrictions placed on using antimicrobials in food animals, we really only have 6 classes of antimicrobials that we use for bovine respiratory disease. So when it becomes MDR, our antimicrobial choices are at least cut in half, and for this specific pathogen, most of the time it's even further than that. What are the benefits of antimicrobial use in animal agriculture? And again, I think the one that we often tout is improved animal health, and I do not want to minimize that. I think it's very important. But what we know through the drug development process, what we know through field trials, and what we know from a clinician experience is that we can make a difference in the outcome for that animal. And I think, to Dr. King's point earlier, it's important that we don't lose that ability to make that difference. Food safety, Dr. Tokes mentioned improved food safety. So antimicrobial use in animal agriculture actually does contribute to improved food safety, but probably not that quite the same way. There were a series of research projects that were done in the early 2000s that looked at the impact of animal health on carcass contamination. And I'm going to make the assumption that antimicrobial use has an impact on animal health. And so what both of these studies essentially showed, that if we could limit or prevent the inflammatory sequelae, so when animals develop respiratory disease, there's an inflammatory process, the lung tissue can adhere to the internal body cavity. During harvest, when we're removing the internal organs, those adhesions, those inflammatory lesions, can actually cause tears in the internal organs, and that leads to fecal contamination of the carcass. So the ability to not only treat, but also prevent animal illness has a role in food safety. And the last point I'm going to talk about, and there's probably several points to make underneath, there's economic benefits to using antimicrobials in animal agriculture. We always talk about the farmer, and I think that's pretty obvious, right? If we can mitigate infectious disease and disease losses through antimicrobial use, there is a benefit to somebody that's raising food. There's also a national economic benefit. By benefiting an individual producer, we do that enough times across our population. Animal agriculture has a very large impact on our gross domestic product, and we can increase productivity through using antimicrobials for treatment and prevention. Again, growth promotion is off, and increase that positively. And I think the last point, there is a direct economic benefit to consumers. If we can mitigate infectious disease losses through using antimicrobials, we raise animals more effectively, and we can decrease food prices. And I think in most of these venues, that's difficult. That may even be a completely foreign concept. And I think part of the reason is we spend such a low percentage of our household income on food that a small increase in food prices is probably imperceptible. If you look at the average American, we spend less than 7% of our income on food. Around the world, the average is 23%, and in a lot of developing countries, it's at or above 50%. But there is a subpopulation of the U.S., and so this is a graph from the USDA's Economic Research Survey, and it's the blue line on the top is total food insecurity, and the yellow line at the bottom is very low food security. And so we're talking about what percentage of the U.S. population was not able to put food consistently on the table. And if you look at those numbers, for 2013, 5% of our population had very low food security, and 15% of our population had either low or very low food insecurity. And again, that seems like a pretty low number, and much like with the subpopulations of salmonella that we see, we have subpopulations of people. And so if I take that, and again, this is all from that same report, that's actually broken down into several demographics, and the one that I've highlighted here. So that circle represents households that are run by single mothers. And that red bar is very low food security. So there were 10% of households run by single mothers that were not able to consistently put food on their tables. 10% doesn't seem like a big number, so I did the math, and that's about 1 million households. So I think when we talk about economic benefits of using antimicrobials in agriculture, this is one of the impacts that, or the unintended consequences that we want to avoid when we talk about stewardship guidelines. So I'll finish up by I'll propose maybe part of the path forward. I want to leave the rest of the discussion up to you guys as far as how we move on. But I think and I say specifically for this group, because this is not my recommendation to the general public or this discussion as a whole. I think our goal here, again, the goal of NIAA, is to provide actionable solutions. And if we're going to avoid the typical roadblocks that this discussion has, I think we need to have a focus on the antimicrobials that are critically important to both human and veterinary medicine, understanding that can be and is a dynamic situation. So next year I may say something completely different. I think we need to understand the risks and benefits so that we don't make stewardship guidelines in a vacuum. We need to at some point consider the ripple effects that those guidelines will have. And I think we need to design programs that are specific. They need to be practical. And I don't say that as ag putting up a roadblock to we can't implement programs. I had the privilege of hosting a very similar conference last week that was targeted to veterinarians, and the question was asked of them, how do you feel about the new FDA guidelines that are coming down? And the response that I got was, we're a little bit concerned about the logistics of implementing this. We're a little bit concerned about what liability that then puts on our profession. But we are really, really excited about the opportunity to interact with our producers, and we're really, really excited about knowing everything that's going on in their operation. I think a lot of veterinarians felt like before the over-the-counter pathway for feed-grade antimicrobials kind of cut them out of the loop. And now they're excited about getting back in there and knowing, being one of the first to know about what's going on those farms. But I do think we need to consider, as we develop these guidelines, how does that work in the industries? And I guess my perspective on that is we do not want to set ourselves up for failure. Okay? And it's already been mentioned, and I certainly don't want it to beat it to death, but I think our programs need to be measurable. And there are a lot of presenters that are coming that are going to talk about metrics, and I think that's a very good discussion that this group should be having.